Today, we're going to dig into a really big idea that's starting to change how we fight cancer. It's coming from the West Midlands Cancer Alliance, and it's all about making a super critical part of the treatment process, well, smarter, not just harder. Just think about that for a second. You've got a room packed with the brightest medical minds, all there to figure out the best path forward for you. But what if they're just overwhelmed? That's the exact problem this new approach is designed to fix. All right, so to really get our heads around the solution, we first need a crystal clear picture of the problem. And that journey starts at the Command Center for All Cancer Treatment, the MDT. So this is the MDT, the multidisciplinary team. And honestly, the best way to think about it is like air traffic control for cancer care. You've got all the experts in one room, surgeons, oncologists, radiologists, all coordinating to guide every single patient to the safest, best possible outcome. And, this isn't some brand new idea. The MDT has been the gold standard in UK cancer care for literally decades. It actually became a required part of the process all the way back in 2000. It really is the cornerstone of how we deliver high-quality cancer care. But here's the catch. As amazing as the MDT has been, it's now a system that is under a ton of strain. That cornerstone we just talked about? Well, it's starting to show some serious cracks. So why the sudden pressure? Well, the whole landscape of cancer has changed. We're seeing way more patients, their cases are getting more and more complex, and there's a huge demand for personalized treatments. And when the role is you have to discuss every single case in full detail, you end up with a system that's just stretched to its breaking point. And here's why that's such a big deal. When every case gets equal time, the patients who desperately need that concentrated expert brain power, they might not get enough of it. The team's focus gets spread thin across dozens of cases, and the risk is that the most complicated, toughest challenges don't get the deep dive they really, really need. Which brings us to the really cool part of this whole thing, the streamlining solution. It's a genius way to relieve that pressure and get that incredible expertise refocused right where it needs to be. So the secret sauce here is something called standards of care. You can think of these like pre-approved playbooks for the more common, less complex cancer cases. They're all based on the absolute best national evidence, which means you get a top-quality, consistent plan without needing a full team debate every single time. Okay, this slide right here, this is the aha moment. And let's be absolutely crystal clear on this point. This is not about cutting corners. It is not about reducing the quality of care. It is the exact opposite. It's a strategic move to make sure that the incredible expertise of the MDT is concentrated on the patients who will benefit from it the most. So this all sounds great in theory, but what does it actually look like in practice? Well, let's take a look at a real-world example right from the West Midlands document, Bladder Cancer. It's actually pretty straightforward. It all starts with sorting patients into different risk groups. The high-risk cases, we're talking complex tumors, aggressive stuff, they go straight to the full MDT for a deep dive discussion, no question. But for the low and intermediate risk patients, where the treatment path is pretty well established, they follow that pre-agreed standard of care. It's a simple but incredibly effective triage system. So the patient's journey just becomes so much more efficient. You get your diagnosis, you get a risk assessment, and bam, you're assigned to the right pathway. There are no unnecessary delays. Whether you're the person who needs the full team or the person who fits a proven protocol, your treatment gets started right away. So what's the bottom line here? This is about so much more than just making meetings shorter. It's about creating a fundamentally smarter system of care that leads to better results for absolutely everyone involved. So let's just quickly recap the benefits because they're huge. Number 1, the most complex patients get more dedicated expert time. 2, standard cases get proven, efficient care without delay. 3, it helps reduce that postcode lottery so care is more consistent. And finally, it makes the absolute best use of our most precious resource, the time and expertise of our clinicians. This quote from the document itself just says it all perfectly. The goal is to maximize discussion for the complex cases and create a clear protocol for the less complex ones. It's really just about applying the right tool for the right job. And that kind of leaves us with a bigger question, doesn't it? This is just such a brilliant example of innovation in cancer care. It really makes you wonder, where else in our healthcare systems could these kinds of smarter, more focused approaches unlock better outcomes for all of us?